Hello, everyone. Good afternoon. Welcome to the July 8th edition of the COVID-19 weekly media briefing and situation report. Thank you for joining us on a soggy day out there, but welcome rain for our farmers and all of our gardens and our plants. Very pleased to have our elected officials with us today, as well as many of our local reporters. And so with that, let's get underway. And we'll take a moment to respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, so to start us off, I'd like to invite our Board of Health Chair, Mayor Andy Mitchell, to share some opening remarks. Please go ahead, Mayor Mitchell.
Thank you, Brittany. To borrow an old sports metaphor, when it comes to vaccines, it is now crunch time. We've made good progress across the country, throughout the province and here locally. Canada's first vaccination rates are among the best in the world. And in Ontario, more than 50% of adults have now received a second dose. Here in Peterborough region, the numbers are also encouraging, and Dr. Salvatera will provide details in her report. This is good progress, but it is not enough. As we move towards a step 3 reopening, and as the new school year approaches with our kids hopefully back in the classroom, it will be important that we are near or at herd immunity. Given the transmutability of the Delta variant, we need a significant portion of the population vaccinated. Peterborough Public Health, PRHC, and local pharmacies are all administering vaccines in our area. Please go online or call and make your appointment. In addition to our normal mass vaccination clinic at the Evinrude Centre, next week an additional clinic will be hosted in Norwood. It is also important to remember that as we work towards greater immunization and allow for additional activities, we remember the 3 W's. Watch your distance. Continue to maintain a distance of 2 meters when with people outside your household. Wear a mask when physical distancing is not possible. Wash your hands frequently. These precautions are important. The Delta variant is circulating in Peterborough. A new outbreak has occurred, and new cases are being reported almost daily. We have not yet achieved herd immunity. Let's finish the job. Everyone, please get vaccinated. Stay safe, be well, and in all things, be kind. Thank you.
Thank you very much, Mayor Mitchell. All right, so let's have a look at the numbers, and I'll invite Dr. Salvatera to lead us through these next few slides. Please go ahead, Dr. Salvatera.
Thank you, Brittany. Hello, everyone. I wish I had better news to share today, but currently we are following 29 active cases in the community. And this is more than double the 11 cases we reported last Wednesday. The number of close contacts currently stands at 45, and we have evidence of both the Alpha and the Delta variants circulating in our community. Next slide, please. Here you can see our weekly counts, and you can see early signs of increases week over week. This is certainly not going in the right direction. It is a concerning trend and a strong reminder why we must remain vigilant in following public health measures and to use this time to get vaccinated. Next slide, please. As far as active outbreaks, after a few weeks of being outbreak free, we are reporting one active COVID outbreak in our community. It is an outdoor workplace, which again, I think reminds us that these variants are very transmissible, even outdoors. But in addition to this one outbreak, we also have clusters of transmission occurring in North Kawartha, with spread from a social gathering to a childcare setting and now a local business. I must say that I appreciate the Mayor of North Kawartha's offer to support, and we are continuing to investigate and also looking at potential responses that we can offer that community. Next slide, please. Starting on the right-hand side of this slide, you can see that our weekly case incidence rate in Peterborough is now, for the period ending June 28th, is now at 19 cases per 100,000. And that's a significant jump for us from last week when we were reporting a weekly case incidence rate of only 2.7 cases per 100,000. You'll also notice that the provincial weekly case incidence rate is 9 per 100,000. So this is the first time in the whole course of the pandemic that Peterborough's local rate is higher than the provincial case incidence rate. In fact, it's not only higher, but it's more than double the provincial rate. And we have the dubious honor of having the fourth highest weekly incidence rate in the province. With this map, we are showing the number of active cases in each region of the province, and Peterborough is in the third lightest, if that's a word, a range of pink, the same as Niagara and Wellington, Dufferin, Guelph. Next slide, please. I do have some good news to share, and that is that our wastewater surveillance here in the city of Peterborough is showing decreasing evidence of the COVID-19 virus. And this continues to align very strongly with case counts here in the city. So it does remain a very useful tool for us. It certainly gives us some degree of hope. And I'm happy to say that the Millbrook wastewater surveillance is also showing no evidence of virus. Next slide, please. Let's move on to vaccination. And here we are showing the current vaccination data at the end of yesterday's clinics here in Peterborough. The numbers continue to climb, and the gap between those who have received just a first dose and those who are fully immunized with the second dose is starting to narrow. Currently, over 99,000 local residents have received a first dose, which is only about 1,300 more than we reported last Wednesday. So certainly that is slowing. But that works out to be about 77% of local adults aged 18 and over. And when we look at our youth rates so far, we are showing that 61% of our youth aged 12 to 17 have received their first dose. Where we've actually seen the highest jump is with second doses. As of yesterday, close to 56,000 second doses have been administered, or almost 12,000 more than last week. So you can see that we're doing well there, despite having started later than many of the provincial hotspots. We are keeping very close to provincial achievements. And you can also see that we need to continue to focus on our youth aged 12 to 17. In terms of the eligible population here in Peterborough, 76% have now received their first dose, 42% have received their second dose, and as our board chair noted earlier, when you look at the whole population, however, the vaccination rates are lower because there's still a large proportion of our population that is not eligible for a vaccine yet. The pediatric vaccine trials are still in progress. They're not expected to report their results until the fall. And so until we are able to immunize all of our population, including our children, we will see that our unvaccinated residents can and will continue to fuel the pandemic unless they follow all of the recommended public health measures. Next slide, please. And here we see on this slide, the bar graph, the percentage of first and second doses by ages. And hopefully we'll start to see those green second dose bars catch up to the purple first dose bars. And the first dose bars among those under 50, we'd like to see those increase even more. So when I look at these numbers, it indicates to me both the cases as well as the vaccinations, that we continue to be at a very precarious point in our pandemic. And for the first time in this pandemic, our weekly case incidence rate is worse than the provincial rate. In fact, as I said earlier, we have the 4th highest weekly incidence rate in Ontario. I might add that our community test positivity rate is also higher than the provincial rate, as is our reproductive number. This means that transmission here in Peterborough can continue, probably will continue, with more cases emerging unless we are vigilant and adherent to public health measures. On the enforcement side of public health, we are conducting an inspection of a workplace today that has been the subject of several complaints, and we certainly are prepared to take whatever enforcement or other follow-up actions are deemed necessary. We also can observe elsewhere in the province that most hospitalized cases of COVID-19 are in patients who have either 1 dose or no dose of the vaccine. And that's why it is important to make vaccinations as accessible as possible. I think it's never been easier to get a first dose of a vaccine than it is now. We have been offering first dose walk-ins at the Evinrude Centre, first dose walk-ins for youth now at PRHC, and we will offer walk-ins at the upcoming Norwood clinics next week from July 12th to the 14th. At the Evinrude, we've been vaccinating 60 to 80 people who've been walking in each day, and we have the capacity to do more. So I do encourage everyone who has not had their first dose to head down, get immunized at one of our mass immunization clinics, or head to your closest pharmacy and get yourself on a list there. As our shipments of Pfizer vaccine increase later this month, we will be able to offer more doses to our youth aged 12 to 17 years. And now that the shortened interval for youth has been announced by the province, I do urge families to get their adolescents vaccinated as soon as possible with their second dose, so that, and certainly no later than mid-August, so that they are fully immunized and ready to begin the new school year in September. And for any adults who are still hanging on to their second dose appointments late for August, please consider rebooking and choosing an earlier date. We do have lots of availability as of July 17th, and as our board chair noted, it's crunch time. Earlier this week, the Peterborough Interagency Vaccine Planning Team, or our local vaccine task force, reviewed our numbers and adopted a new vaccination target for our Peterborough COVID-19 vaccine campaign. With the emergence of the Delta variant, which is more transmissible than the previously and still circulating Alpha, the need for 2 doses has become much more urgent. Our vaccine task force has decided to increase its target from 75% to 80% of all of Peterborough's residents aged 12 years and over to be fully immunized by September 1st, 2021. I know some parents have expressed concerns over the reports that they've been hearing in the news about myocarditis connected to the mRNA vaccines. Since April 2021, there have been increased reports of cases of myocarditis and pericarditis after an mRNA vaccine in jurisdictions such as Israel and the US. Here in Canada, there have been a small number of these reports, but no conclusive association between myocarditis, pericarditis, and the mRNA vaccines at this point. However, the Public Health Agency of Canada, Health Canada, and Public Health Ontario are closely reviewing our data and monitoring these rare events, including those among youth. So in the meantime, what can I tell you? Well, the international and national reports of myocarditis following vaccination with a COVID-19 mRNA vaccine indicate that cases have been seen after the first dose, but are more commonly reported after the second dose. The symptom onset typically is within several days following immunization, with most cases being reported within 7 days. They're mainly in adolescents and young adults. The median age is 19 years. They're more often in males than females. And the cases so far have experienced mild illness. They've responded well to conservative treatment and rest, and the symptoms have improved quickly. In the US, the Advisory Committee on Immunization Practices performed a risk-benefit analysis for youth based on the 52 million doses of mRNA vaccine that had been administered in the US to persons aged 12 to 19. And based on those risk-benefit analyses, they have recommended that all age groups still experience far more benefits of immunization than risk. And so they continue to recommend that youth be immunized. So please stay tuned on this topic for more from us. I am planning to hold another educational webinar video on myocarditis and the vaccine as soon as we do receive formal guidance from the National Advisory Council on Immunization, or NACI. So with that, I'll end and I'll pass the mic over to you, Brittany.
Thank you very much, Dr. Salvatera. Okay, well, it turns out that our local elected officials have all contacted me and have had other commitments come up. So we will not be hearing from them today, but hopefully they can join us again next week. So with that, I am pleased to move into the opportunity for media questions. So thank you all for joining us. And let's start with Matt Latour from Freak and Oldies Radio. If you've got some questions for Dr. Salvatera. Oh, and I should mention that we are fortunate to have with us Staff Sergeant Dan McLean from the Peterborough Police Service and Constable Joe Ayat from the OPP if there are enforcement related questions. So go ahead, Matt.
Perfect. Can you hear me? I just want to make sure. Awesome.
Yep,
I'm using a new
here.
computer today, so I wanted to make sure. My only question has to do with the vaccination rates. I saw that the first dose percentage for people 20 to 29 was lower. You addressed that a bit, and I know down in the US, there's kind of incentives to get a vaccine. Would you like to see something like that here in Canada?
I certainly know that that incentives are being tried in other provinces. I think incentives are a great idea for that group, but I do think, Matt, the answer really is to make the vaccine as convenient as possible. It has to be ready when they're ready. So that means, you know, looking at the hours, the availability, the ability to just pop in and walk in and get a vaccine. And we are going to focus in a little more closely on that population and see what else we could be doing locally to make it easier to have get that vaccine for that age group.
I was going to say, I know there's pop-up clinics for first doses and whatnot, so it seems like it's already pretty convenient, but I guess some people are busier than me. I was going to say, what else do you think could be done to make it easier for people?
Well, I think taking the vaccine to them, right, where they are. And I know we've done that this past week at City Hall. We had some pop-in clinics, vaccine clinics at City Hall, just to try to bring the vaccine out to groups that are more vulnerable and you know, certainly would not potentially go to a vaccine clinic. So taking the vaccine to them, it's a little challenging with the mRNA vaccines because they are kept frozen, and once you thaw them, they have a very short shelf life. So they're not the most portable vaccines I've ever worked with. So we're trying to find ways to work with those challenges and make those vaccines as available as we can.
Does the lack of Johnson & Johnson availability concern you at all, or do you think we're doing pretty well now that everything seems to be rolling out a lot quicker?
I wish we had the Johnson & Johnson. It's a refrigerated vaccine. You only need one dose. We had a lot of hopes, you know, in the Johnson & Johnson vaccine. I must say those have faded because I think by the time it does become available, hopefully we'll have had most of our population immunized. However, you know, there may be still a role in for future, certainly for outbreaks in shelters or in correctional facilities, or you know, or for people who are traveling. It still may offer some benefit. But I think we've certainly just moved ahead without the benefit of having that vaccine.
That's it for me. Thank you.
Okay.
Thank you very much, Matt. Okay, let's hear from Bill Hodgins from Peterborough this week and my Kawartha. If you've got some questions, please go ahead, Bill.
Thank you. Just a couple of questions. There seems to be a bit of a call for walk-in clinics for the second dose, and I know they're not being offered, but are they on the horizon?
I would say yes. We are definitely considering that. Right now, we still have really good uptake of appointments, lots of interest in second dose appointments. But as that starts to slow, I'm sure we'll be offering walk-ins for second doses as well.
And the other question had to do with the local bump in the number of cases, and I wondered if you thought any of that might be attributed to complacency, or even the fact that we've entered this new stage of reopening.
I think, well, we have really two big clusters, Bill. One is in the outdoor workplace, and there was not the adherence to PPE that is expected in a workplace. And with transmissibility of the variants, despite these workers working outdoors, there was lots of transmission that occurred. And so that's a big group of our cases that we're following. The other group is the North Kawartha cluster. I would say that the public health measures were not followed there for the social gathering, and that it spread from there. It doesn't take much, right, to light the fire and then to just see it spread out. We saw that with the Severn Court outbreak in February, and I think we're seeing a little bit of that in North Kawartha on a smaller scale, but quite concerning.
Okay, that's it for me. Thank you.
Okay, thank you very much, Bill. I see Danelda Frazier is joining us from the Havelock Rail. Did you have any questions for our speakers today, Danelda?
No, none today, but thank you.
Okay, thank you very much for joining us. Matthew Barker from the Examiner. Did you have some questions? Go ahead.
Hi. I just have one. When it comes to the, you were talking earlier about the, and I just, so you were talking earlier about transmittability and how the Delta variant is way more infectious than or contagious than the Alpha. Now, can you kind of explain how that works in coronaviruses for me and how they become more contagious? And also, when a coronavirus, can you correct me if I'm wrong, but is a coronavirus, as it becomes more transmittable, become less lethal?
Well, good questions, Matthew. I mean, typically that's what we tend to see in virology is that the genes, as viruses acquire the genetic ability to become more easily transmitted, they often lose their virulence. Not always. In the case of Alpha variant, which we have, and that's the we have Alpha variant up in North Kawartha that's circulating. It's more transmissible and also more virulent than the wild virus that first started the pandemic last year. With the Delta variant, it's even more transmissible than the Alpha, about 60% more, and I think the jury is still out on whether or not it causes more severe disease. And we just need to acquire a little more data in order to be more certain about that. Why are they more transmissible? Mutations on the spike protein, potentially. That's where allowing the virus to attach more easily to the receptors on the cells, the respiratory cells, is probably the main reason why the virus is so much more easily transmitted. But there are each mutation, you know, may provide a little more reason, whether it makes it less detectable by the immune system, you know, less ability of the immune system to neutralize the virus when it's encountered. You put it all together, right? And it may give you the scenario that we see, that it spreads a lot more easily. I think as well, what they've noticed with, at least I believe with Delta, is that people with Delta tend to shed more virus. So they're shedding more, making it more contagious to their close contacts.
All right, thank you.
Okay, thank you very much, Matthew. Okay, so joining us from Kawartha now, we have Hannah Abrahams filling in for Paul Rellinger. Welcome, Hannah. If you've got some questions for Dr. Salvatera, please go right ahead.
Thank you. Hi, Dr. Salvatera. I do have one question that we're receiving a lot from our readers. It's actually related to the local vaccination rates that you shared with us today. How does the health unit track this? Is it by local clinic or is it by address? I think that there's concern that if individuals are leaving the area to get their vaccine, that they might not be tracked.
Well, the answer to your question, Hannah, is it's both. We track the number of doses that we administer at our clinic, but we also track the addresses and the postal codes. And all of those addresses and postal codes have been matched to a public health unit. So if one of our residents travels to Lindsay or Port Hope and gets an immunization there, we still get that information. But so does the clinic. So we actually look at both. And if you look at our tracker, we do report both. We report the number of doses administered, and then we report, thank you. So Brittany's fast, she's going there. So Hannah, if you look at the orange on the top left, you see the 159,000. That's the total number of people we've immunized or administered a dose to in our clinics. And then you see the middle one, the 99,000. That's how many of that were to Peterborough, first doses to Peterborough residents. And then you, now the green total residents first and second, I believe that's also Peterborough residents who've had both their first and second doses. So we do slice and dice it in different ways.
Awesome, thank you.
Great, thank you, Hannah. So then to round things off, we've got Jessica Nisnik from Global News. So go ahead if you've got some questions, Jessica.
Thanks, Brittany. Hi, Dr. Salvatera.
Hi, Jessica.
Can you tell us any more about the outdoor workplace? What is an outdoor workplace?
Outdoor workplace. Think construction, Jessica.
Thank you.
Okay.
Thank you. I wasn't sure. I was like, I know gyms are going outdoors now, but they're not outdoor workplaces.
Yeah.
Okay, Dr. Salvatera, all we hear about is why are our numbers going up? So I know you've talked about it, but is there a certain age group? Are these people vaccinated? What is going on?
Well, most people who are cases are not vaccinated. And the data that we have, Ontario data, that also supports that. Most of the cases we're seeing are in unvaccinated cases or in people who've only had the one dose. And the one dose, particularly when you're looking at the Delta variant, because one dose only gives you about 33% protection. But here in Peterborough, I can say that the workplace, our investigation showed that there were deficits as far as adherence to the use of personal protective equipment. And so that even though these people are working outdoors, they were able to spread it to each other. And for the clusters up in North Kawartha, as I said earlier, we're aware that they began with a gathering that took place on Father's Day, before indoor social gatherings were allowed, and that gathering, that there were people who were infectious and who spread it to others, and it's just taken off from there. And again, I believe the cases, and I can't be sure, but I've heard from staff that many are not immunized.
Okay, and just to ask again, was there a certain age group? Are we looking at, because I know obviously the outdoor one could be a varying age, but overall, is there an age group that you're seeing?
I haven't seen the data presented to me by ages, Jessica, but we can certainly look at it. I can ask for it and see. I mean, but as you know, and we didn't present the data today by ages, but typically most of our cases are under 29. I'll have to see what the active cases are like right now, and we can get back to you on that.
Okay, that's really it for me. That's all I hear about. Why are we going up when everyone else is going down? And I never know what.
It's very disappointing. I know it's very discouraging, but I think again, it just reminds us that we can't be complacent. We have to follow the rules, and the rules are there for a reason. There's good reason. There's evidence behind them. And if we can follow those public health measures, we can potentially move ahead to step 3. But if we don't, we can go backwards. I mean, we know that some of the other areas in the province that are experiencing high rates of transmission did not follow the reopening and actually had to step back. And that's a potential for Peterborough as well.
Well, actually, could we be left behind? Yeah, we can be.
We could.
I just thought because it was a provincial rollout that they'd either have to wait for us, that we couldn't be left behind.
No, if you go back and check with both the step 1 and the step 2, there were jurisdictions in Ontario that were left behind because of the high transmission rates that they were experiencing at the time.
Okay, that's it for me. Thank you.
Okay.
Great. Thank you very much, Jessica. And I think that wraps us up. So thank you to all of our speakers today. And we will see you back here next Thursday, July 15th at 12 noon. Greatly appreciate your time. And do let us know if you have any follow-up questions. You can just send me an email. Okay, have a great day. Stay safe out there. Take care. Thank you.
Thanks, Brittany.
Thank you, everyone.